So, what is degenerative disc disease and how does that cause low back pain? What can you do about it? Is there a better way than drugs and surgery to get well and reverse the process or even stop it from progressing entirely? Yes, there is. So, I'm Dr. Aaron Wall. I'm with Gateway Chiropractic. If you're wondering that question, if you're dealing with low back pain and you might have degenerative disc disease, maybe you've been told that you have that. There's other names, arthritis. There's disc, herniations, disc bulges, degenerative joint disease, degenerative disc disease. All that means the same thing. It means that the discs themselves are withering away, they're starving of nutrients, and that is a really nasty disease process that you don't want to be into. But good news, there's stuff you can do about it. So what I want to start first is kind of showing you the difference in what this is. So I have a couple of models here. I have a few I'm going to show you. I'm going to show you the big model where it all kind of makes sense in a second, but just from a disc model, this first one I want to show you. So this is a normal disc in between a bone of this is a lumbar bone, and then another disc and then another lumbar bone. So you can see the anatomy of it. And I spoke earlier, we had another video you should check out on what's the difference between a disc bulge and a disc herniation. So we have a really cool video. Check that one out as well. But disc degeneration is kind of a different thing because all these things can lead to disc degeneration. You can go from a normal disc, which we talked in the prior film. You have the outer layer, the annular fibrosis area. The nucleus pulposus is the little jelly inside layer of the disc. It's where all the hydration comes from. And these discs serve as shock absorbers for your spine. So this lets you move and bend and turn and twist and bend over and lift and use your spine, but nothing is causing you pain because you have that shock absorption. Well, life happens, and this could be a million reasons why your spine gets really, really bad, but it always starts with structure. Your spine gets stuck out of alignment. I'll show you how that happens in a minute. But then, the discs over time, because they don't move anymore, they start to starve. See, if you didn't know this is a really important point. The only way that this disc gets nutrients to stay healthy and hydrated is through proper movement of your spine. There's no blood flow to a disc. So that means if this spine gets stuck out of alignment, and I'll show you what that looks like, it's called subluxation, then over time, these discs start to starve. They don't move well. They get, they're lacking nutrients. And as time goes on, they degrade. So it can get pretty nasty. You might have heard of disc bulges, disc herniations. Those both can happen. That is a form of degeneration. But what we're going to focus on is if you don't do anything about it, how bad this stuff really gets. So this is full on like osteoarthritis, bone and disc degeneration. So if you can see how the bone itself is changing its structure, it doesn't look very healthy. It looks like it's all hourglass shape. The disc, see how there's really not much of the inner layer, that gelatinous area that's dried up. And then the disc isn't very high. It's all shrunk down. This is an example of disc degeneration. It's nasty. It is a disease process. And just like any disease, it spreads. So it might be starting in one area of the back. If it's not addressed or worked on, so to speak, it goes up and down. It can spread everywhere. Now, how does this get this bad? You would think the second you start having this happen, you'd feel it. Most your discs and then the nerves that come out of these discs, they don't process pain as good as you might think. So degeneration or arthritis can sneak up on people for years. And when you start having the pain from it, because that's what it gets to. You might not notice it at first, but you will notice, disc degeneration. It's going to get to where, you can't move very well at all. That's usually one of the first signs, by the way, is you can't move very good. You're very stiff. You might not have a lot of pain, but you're really stiff. That's a big warning sign. You should have flexibility in your spine. That could be this building and you not know it. But it does get to the pain aspect where it could be pain on any movement you have. Can't bend without pain. You can't bear down. You can't go to the restroom without pain. It can spread down your legs, like sciatic pain as well. It can affect the disc, affect the nerves, affect the cord. It's a mess. And the reality is when people get to that stage, they think that surgery is like the only option. And it's not. Even in really bad degenerative stages, we see a lot of patients with this. It's a structural thing. I want to show you kind of the cause of it because a lot of people don't understand cause. See, those discs, they should be shock absorbing your spine, but your spine needs to be in a certain alignment for your body just to heal well and to keep these discs hydrated and healthy. So if you're looking at me, from the front, so to speak, your spine should be straight up and down. That protects the disc, that protects the bones, protects the nerves that come out. From the side, though, if you're looking at this from the side, You need a lumbar curve. Now, this is really key because most people, I'm talking like 9 out of 10 people that have low back pain that come to our office for help, we do the thorough exam and x-rays, but these are patients that I see that have done this. They've lost a lot of their natural curve in their back. What that does, that puts abnormal pressure on the disc, abnormal pressure on the nerves. It can cause a lot of pain in the beginning. It can cause a lot of tightness and range of motion problems. But as time goes on and that's not fixed, these healthy discs can turn into this because they're not moving anymore. And so this also can happen like from the side, the spine can bend. And a lot of times this happens and you don't feel it right off the bat. But this type of problem can also create disc degeneration over time. And so our office, what we do is through detailed analysis, detailed x-rays to be checked for where these subluxations are, we're able to start correcting it with specific adjustments in rehab to train the body to keep that pressure off. Our other goal would be to restore the curve and get stability back. This saves the disc, this rehydrates what's left of those discs that are degenerating, and it helps a person get back to functioning at a much better rate, reduces the pain, gets them healing better, gets their life back. So just hopefully that makes a little bit of sense with what disc degeneration is, what you can do about it. But yeah, if you're noticing or if you know you have that and you want help with that, there's a schedule my appointment link on this page. You can check it out. Let us help you because I promise you, in most cases, you don't have to have surgery. You can do a lot before you get to that point. And like I said, hopefully this video helps you out with that, and we'll see you in the next one.